Assalamu alaikum. My name is Hamza Sarwar. I am the student of Osh International Medical University, third year. My group is 3C. Here I am going to explain bronchiectasis. Bronchiectasis is an uncommon disease that results in the abnormal and permanent dilated, inflamed, easily collapsible, resulting in the airflow obstruction of one or more conducting bronchi airways, most of secondary to infectious processes. It is may be congenital or acquired. Most often occurs in adults and older children. An infectious insert, impairment of drainage, airway and obstruction. It is a host defect. It may be focal, involving a lobe, segment or subsegment of the lung of the most common. Diffuse, it may be involving the both lungs. Most often associated with systemic illness such as cystic fibrosis and sinopulmonary diseases. Its pathophysiology includes host to response to infection. First, neutrophilic proteases, inflammatory cytokines, nitric oxides and O2 radicals. This will damage to the muscular and elastic components of the bronchial wall. Diffuse peribronchial fibrosis. What are the causes of bronchiectasis? It is cystic fibrosis, lethal inherited disease which in whites caused by the defects in the genes for cystic fibrosis transmembrane conduction regulators. Bronchiectasis associated with cystic fibrosis occurs secondary to mucus plugging of proximal airways and chronic pulmonary infections. Here it is the imaging of the bronchiectasis lungs. There are primary infections and typical organisms. In primary infections, bronchiectasis may be the sequel of a variety of necrotizing infections that are either poorly treated or not treated at all. And the typical organisms which are included in the causing of bronchiectasis are Staphylococcus aureus, Mycobacterium TB, Mycoplasma pneumonia, and measles virus and proteases viruses. Organisms colonization may result in ongoing damage and episodic infections exacerbations. Bronchial obstruction and aspiration. Primary salivary dyskinesia, Cattarnger, citrus virus, nasal polyps and sinusitis, respiratory tract. Allergic bronchopulmonary aspergillosis. There are also immunodeficiency states in the bronchiectasis. There are some rare cases which may cause the bronchiectasis: congenital anatomic defects and connective tissue disorders, alpha antitrypsin ATT deficiency, autosomal dominant polycystic kidney diseases, and toxic gas exposures. The clinical features of bronchiectasis: multiple episodes of infections, cough and daily production of big amount of mycopurulent sputum, blood-streaked hemoptysis, dyspnea, pleuritic chest pain, wheezing, fever, weakness and weight loss. These are coarse crackles. Scattering wheezing may be due to airflow obstruction from the sinuses, wasting and weight loss. Respiratory failure may be also the clinical feature of bronchiectasis. It is the imaging. These are the imaging of the lungs in the X-rays. Here it is also. The laboratory studies which we are doing to diagnose the bronchiectasis: sputum analysis, G-stain, AFB and CSB. CBC count we are going to check, quantitative immunoglobulin levels, quantitative ATT levels, sweat test, genetic analysis, Aspergillus preceptus and serum to IgE levels. There are also some pulmonary function tests. Last we have the treatment of bronchiectasis: antibiotic therapy, oral parenteral and aerosolized antibiotics, chest physiotherapy, postural drainage, bronchodilatory therapy and azithromycin we can give in the treatment of bronchiectasis. There may also be need surgical care. Surgery should be reserved for the patient who have focal disease that is poorly controlled by antibiotics. If the antibiotics are not going to heal the bronchiectasis, then we can move to the surgical procedures, massive hemolysis and foreign body or tumor removals. Thank you.